time. And once that gets to a critical level where the artery is narrowed, like I said, about 70% or more, people may start noticing that they're having symptoms, generally exertional chest discomfort, heaviness, tightness. Sometimes this presents atypically more in women with jaw, back pain, things like that, shortness of breath, and exercise intolerance. And like I said, then they may go to their doctor with these complaints, and some testing may be ordered, like stress tests that lead them to the cath lab where they get diagnosed with these blockages. But again, this disease process in most people is building up slowly over decades of time. And we're starting to be more aggressive with what we call primary prevention or primordial prevention, even meaning preventing risk factors, preventing atherosclerosis from happening silently by being more aggressive with cholesterol management, more aggressive and diligent with screening for high blood pressure and treating it, screening for diabetes at younger ages. But really, unhealthy lifestyle is a big driver of a lot of these risk factors as well. And so we really need to do better with educating. I would tell you at a very early age, childhood age, the importance of staying active, of continuing to exercise every day throughout your lifetime. Education about nutrition, which is quite difficult. We have a food industry here that is promoting, you know, um, hyper palatable, unhealthy, very processed foods that are highly addicting, not just to children, but to adults. And so it's very, very difficult to sort of combat these forces at play that are really influencing our lifestyle choices. Um, Recently, there was a study that came out that looked at the number of children in the United States eating fruit, and it was less than 50% of children in the United States are eating fruit on a daily basis. And that to me is such a worrisome statistic, because if that few of our children are eating fruit, you can imagine how few are eating vegetables and healthy grains and beans and legumes. The average American consumes more than 60% or two-thirds of their calories in a day are coming from ultra-processed foods. So you touched a little bit on meat, but a bigger problem is that we're eating these ultra-processed food substances, really, and not healthy foods, a variety of whole food, plant-based foods that we know are going to help reduce our risk factors for cardiovascular disease and other chronic diseases.
And bad cholesterol. And how do we know the difference?
Between good and bad cholesterol? I'm sorry, you cut out.
Yeah, I mean, because I guess the cholesterol is produced from what we eat.
So cholesterol is quite complicated, but we certainly can touch a little bit upon it. So when you get a cholesterol panel checked, you'll see several different numbers on the panel. You'll see a total cholesterol, which is measuring all the amount of cholesterol being carried by different particles
So,
throughout
so
the
what is
bloodstream.
cholesterol? First off, what is cholesterol?
Sure, sure. So cholesterol is a type of fat that is produced actually by our cells and by our liver. All of the cells in our body can produce cholesterol, and it's a key fat that we need to maintain our cell membranes. And so, because it's so critical, all of our cells can produce cholesterol. The cholesterol that's circulating in our blood is actually not used for the most part by our cells. It is there being transported from place to place in particles called lipoprotein particles that also carry other fats like triglycerides, which are used as a fuel source, and some phospholipids, which again are used to maintain cell membranes. And so the cholesterol that's carried in the blood is kind of there to maintain the spherical shape of these particles traveling throughout the bloodstream. And cholesterol that's called good cholesterol versus cholesterol that's called bad cholesterol is just the cholesterol that is carried by different types of particles. So high density, lipoproteins or HDL particles are quote unquote carrying the good cholesterol. And really, this is a little bit of a misnomer because HDL cholesterol, we don't really know if it's actually good. It depends on which way it's transporting that cholesterol. And if it's transporting it away from our arteries and back to the liver for us to dispose of it, to excrete it, then it's functioning appropriately and it seems to be protective. This is in comparison to LDL or low density lipoproteins or quote unquote the bad cholesterol. And this is called the bad cholesterol because these particles are small particles that can squeeze in between the cells that line our blood vessel and get into the blood vessel wall. And once the concentration of the LDL particles in the bloodstream is above that sort of physiologic threshold I talked about, that 50 to 60 milligrams per deciliter, the cholesterol particles, these LDL particles, will start getting into the artery wall. And for the most part, the general rule is the higher your LDL cholesterol or LDL particles in the bloodstream over the longer period of time, the more number of years, the more plaque buildup or atherosclerosis we get in our arteries. So having high LDL cholesterol is a big risk factor, one of the most important risk factors for developing atherosclerosis and putting us at risk for heart attack and stroke throughout our lifetime.
I am an African American male, again, 71 years old. Is there any hereditary uh, relationship between high blood pressure, heart disease, and those kinds of things, or is there any health disparities based on demographic groups?
Sure, for sure there is. So there are genetic factors at play, some of which we know about for people in terms of having high cholesterol for sure, as well as being more prone to develop atherosclerosis even at lower cholesterol numbers. There are disparities in healthcare that directly put people in low socioeconomic status of certain races at higher risk. Things like housing insecurity, food insecurity, even intergenerational trauma, current trauma for people. I mean, you can imagine someone who is housing insecure, really is probably not worried about, eating a variety of fruits and vegetables every day. Someone who lives in a place where there's no grocery store selling fresh produce and is having to buy whatever food they can to sustain themselves at the cheapest price, is not worried about the heart attack and stroke they may have 2 and 3 decades from now. So, health disparities. And of course, demographics and the race disparities that come along with all of these issues certainly play a role. Exposure to smoking, secondhand smoking, things like that all play a role in people's risk. Air pollution plays a risk. Living in an environment where you can actually have an opportunity to exercise safely, meaning that your neighborhood is safe enough for you to take walks during the day or even in the evening. So all these things are very important risk factors that we know are at play for people who are in socioeconomic disadvantaged situations.
So, if you're just joining us, my guest is Dr. Uh, Aimee Zullo, and she is a non-invasive cardiologist specializing in managing and preventing cardiovascular disease. Also, she is with Froedtert and the Medical College of Wisconsin Health Network. I have to ask you, you spoke earlier about processed food, and we hear those terms, but we really don't know what that is.
Sure.
What's meant by processed food?
Sure. So I, when I'm educating my own patients on what ultra processed foods are, I generally tell them it's generally shelf stable foods that when you look at the back and look at the ingredient list, it's generally more than 10 ingredients, many of which you couldn't pronounce the names of.
Right.
So it's foods that we take actual food substances like wheat, for example, and we we process it into a flour, and then we take that flour and we add all sorts of preservatives and oils and natural flavors and artificial flavors to it, and we come out with something called a Cheez-It, or
Right,
or a goldfish or something like that.
right.
So in general, these foods have been designed by scientists in labs to be hyper palatable, meaning that it's
Tastes good.
difficult. They taste good. They taste good, quote unquote, and they're very difficult to stop eating them. So I always think back to when I was a kid and you saw the commercial for Lay's potato chips, and I think their mantra was something like, "You can't eat just one," and
Right.
it's true. You can't. You end up eating the whole bag because they're designed to be highly addictive that
Have
way.
you been watching me? But anyway, go ahead.
No, no. um, and eating these foods ends up with people not wanting to eat healthy food because it just doesn't taste the same. And so when I was alluding to the fact that our children are not eating fruit, well, of course they're not eating fruit because fruit doesn't taste particularly good to them when you're used to drinking sugary beverages and eating foods that are full of added sugars and added salts, and added, flavoring to the foods. So our taste buds can change over time, and the opposite is true. If you stop eating these hyper palatable foods and you go back to eating fresh fruits and vegetables, especially things that are homegrown in a garden, or in the summertime when we have farmers markets, are locally grown and not, berries that are, picked down in Central America before they're ripe and sent up on a truck. These foods start to taste delicious to us, and we'll lose the craving for those hyper palatable ultra processed foods. But they're highly addicting, these processed foods, so it's difficult without really cutting them out of your diet, to sort of cut back.
You know, Dr. Zullo, it is. I've had this on my mind for a long time, and again, based on the fact that I am a 71-year-old man, we live in a society where, you would think that if we're worried about the health of the citizenry, then we would be concerned about the foods that are actually being produced for the health of our communities and for the American people. You stated earlier, and it's just factual. I don't care if it's China, if it's Japan, if it's Africa, if it's all of these other nations that don't have the financial kind of resources that we do, and you look at the food that they prepare and what people eat, um, which really tastes great. Their lifespans are longer than ours. I don't understand why we can't seem to understand with the cost of healthcare in this society that we should be doing preventative things than people finding out after they've contracted, cardiovascular disease and all sorts of other things, that we would be doing preventative things.
Yeah, I think it's really a huge challenge for us, and I think a large part of it has to do with probably changes to public policy, changes in sort of how we're subsidizing foods and things like that. But people have power by demanding from our government, from our public health system, healthier choices out there. It just needs to be a sort of a mass movement that way. I mean, we do take baby steps, but I don't know if you remember when Michelle Obama was trying to implement healthy lunches in schools, and the pushback that she got from various parts of the food industry. When she said a French fry shouldn't count as a vegetable, the potato industry kind of went crazy, and it became huge barriers for her to get common sense, healthy foods into schools for children. So the barriers that we face on a large scale from industry are huge. On an individual basis and in a community basis, I think that's where our real power is, through education, through supporting organizations who are doing great work. There are organizations in the Milwaukee community trying to get into schools and teach plant-based cooking to kids and to their families. We have some great sort of food pantries like Kinship Community Center that is trying to grow healthy foods and provide education for the community that's coming there to get food, people who are food insecure, but also trying to give them healthy options and education that way. So I think it starts with educating our children, educating our communities. And some other factors that are barriers that I think that we don't think about is really our society has prioritized convenience, and like we talked about, sort of maximum taste, or I call it sort of the dopamine explosion when you're eating, over really why we're eating, what the point of food and nutrition is, which is to fuel our body with healthy sources of energy. So I think a lot of it is also sort of just getting back to basics of a mindset shift, and realizing that we have prioritized convenience and taste, quote unquote, over what's most important about what we're eating on a daily basis, which again is providing our body with healthy energy sources. So.
You know, Dr. Zullo, this conversation is so valuable and so important because, this conversation, as opposed to what we see in commercials on television, constantly, clearly doesn't get out and the way it should. And that's why I'm so honored to be able to have this conversation and dialogue with you this morning. I can go into a grocery store. We talk about fruits and vegetables, and I see an orange, and it looks perfect. The color of it, it's a perfect shape, and you just think, I can't wait to get a hold to that. And I open it up, and it's as dry as a potato chip, right? And there is no nutritional value or flavor or taste in it. It's not just that, it's the fruits and vegetables that are presented to us. And so when we try to do the right things, we are up against it. Organic fruits and vegetables that cost more. Even when it comes to that, there are people who these main industries have now purchased the organic farms, and they've even kind of taken that away. How? What would you say? And you talked about with during the warm weather and the farmers who kind of do this themselves. How do we know the nutritional value of what we're purchasing? I know it doesn't taste like it used to when I was a kid. I knew when I went and got an orange, man, the sun was in it, right?
Mhm.
Uh, and all of that, but not anymore. The
Yeah.
apples, they look perfect, the color of them, the shape of them, all of those things, but they're lacking nutritional value.
Yeah, I agree with you. It's quite challenging, especially because we're not eating seasonal foods necessarily, right? We can still eat strawberries and raspberries in the winter time, when these obviously are in where we live in Wisconsin, do not grow during the winter time. So a lot of time our fruits and vegetables is coming, from across the country or even Mexico or Central
Right.
South America. um I think the quality of our soil probably has gone down. We have a lot of pesticides that are still being used in the United States that are not allowed to be used in Europe. And so there's lots of factors that do influence, and we can only control what we can control. And if you've ever grown your own garden, I lived in Maine for a few years, and we had wild blueberries that would grow, and raspberries, and even some strawberries, and they were delicious, and they don't taste anything like what you buy in the store. So it is challenging for people, and it is expensive to be buying organic produce and things like that. So I oftentimes tell my patients who are have financial limitations, there's nothing wrong with buying frozen fruits and vegetables. These are still probably just as nutritious as the fresh that you're buying. If you have the means to buy organic, the organic foods are not necessarily regulated, so I don't really know what an organic label means exactly in the United States. So that would be, I would tell people if it's a choice of buying just fruits and vegetables that are not organic and being able to buy more of those, compared to being able to buy a limited amount of organic, I probably would choose the non-organic fruits and vegetables. Things that have skins on them, like bananas and oranges, you probably are not as important to buy organic necessarily. For those types of fruits. But no, it is a real problem. And outside of growing all of your own food, and checking your soil and checking your water for contaminants and all the things, it is quite difficult. But you can choose to not use pesticides on your own lawn, your own property. So to decrease sort of the amount of exposure to those types of things, at least around your house or in your house. You can grow your own garden, both indoors and outdoors. Um, Things that are quite easy to grow are green leafy, so kale, chard, lettuce, these things you can grow in a pot in your house and just clip them off. It's very easy to actually sprout just with a mason jar that has a mesh top. You can buy different types of seeds to sprout, and you can have healthy greens that way. Obviously, growing citrus fruit and things like that here we can't do easily in your home, and so we do have to rely what's on what's in our grocery stores, but it is quite challenging. And I think this goes to your point about people and even our children not wanting to eat fruit because it doesn't taste the same way it used to taste, 30, 40, 50 years ago, and it doesn't taste good a lot of times. And when you're spending a lot of money on these fresh produce, especially if you're buying organic and they're still not tasting good, it is very discouraging. So these are all challenges that we face, certainly in the United States, but to some extent globally.
I would say that I've prior to today and meeting you, I didn't know there was such a person as an non-invasive cardiologist. When did you guys come into vogue, and when should I be seeking out counsel with you, and what is the process?
So non-invasive is also just another term for a general cardiologist. So we're the
Right.
cardiologists that were always here, that didn't sort of break off into interventional cardiologists or electrophysiologists. So we are the bread and butter cardiologists that most people are referred to initially when they see a cardiologist. Um, so it shouldn't be difficult to find us. Oftentimes, in the Froedtert system, patients can self-refer to us in general cardiology. Obviously, it probably depends a little bit on insurance for patients, but our health system allows patients to self-refer. Um, Otherwise, primary care physicians or other types of more general practitioners can refer patients to us. I get referrals from gynecologists. I get referrals, obviously from primary doctors and primary nurse practitioners. And I get a lot of self referrals. So it shouldn't be too difficult to get in with a general cardiologist.
So I have a cardiologist, and that's why at Froedtert. And
Mhm.
as a matter of fact, all of my doctors are at Froedtert. And so I really am excited and thrilled about being able to have my doctors all under one roof, and so there's something very special about my relationship with Freighted because I personally, they've done many great things to keep me moving, and information that I've been able to garner from them. And today is no different. You've come with a lot of information that I think is critically important to people. And and so even though we're faced with all these different things, we can talk about individually, me, myself, and I, but when we're responsible for others, um, you know, it's tough enough to try to deal with your own health. But what would you say? Some of us are still blessed to still have mom and dad around, uh, grandparents still around. They're not aware of this. How should we approach these kinds of conversations with them?
Yeah, so I'm not just a cardiologist, I'm also a lifestyle medicine doctor. So that is an actual specialty in medicine. And in lifestyle medicine, we have six pillars of lifestyle medicine, and the whole premise of lifestyle medicine is to try to treat and prevent chronic illness through healthy lifestyle. And our six pillars are generally our healthy diet, which we generally define as like I said, a plant predominant diet, exercise, so daily exercise, fostering meaningful social connection, stress management, sleep, and then the sixth is avoiding risky substances. So, talking to your family about what are we doing to sort of achieve these pillars of health. And this encompasses not just physical health, but our emotional and our mental well being as well through these six pillars. And I think these conversations you can have with your family, the holidays are coming up. How are we eating? Are we moving our bodies? Are we prioritizing sleep, which seems to be becoming more difficult in our high stress world where we're all sort of on these handheld devices all the time? What are some simple things that we can do to improve these pillars? For example, don't put your mobile phone, your smartphone in your bedroom. Charge it outside your bedroom, even if it's in your bathroom, so it's not the last thing you're looking at night and the first thing you're looking at in the morning. Trying to make sure that you're going to bed at a decent time, avoiding drinking alcohol before bed and minimizing the amount of alcohol we're drinking. If we're smoking cigarettes or using tobacco products, eliminating those. Talking to our children who are, preteen and adolescents about the harms of vaping, that vaping is not okay, that it's not a healthful thing, that it's not any better than smoking. Talking about harmful effects of marijuana and other drug use. These are conversations that we can be having with our family members and with our children. Talking about social connection, not just getting together on the holidays. It's very difficult to stay connected with our busy lives. We're replacing personal interactions with digital interactions. Our children are hanging out with their friends less, they're dating less. This is not just a trend with children, it's also a trend with adults. So, making time to see people in person, share a meal with them, share a coffee, go for a walk, do exercise together. These are important things. Stress management. We live in a highly stressful environment in this country for various reasons. So we can't avoid stress, but how can we better manage our stress? People talk about yoga and meditation and things like this, but even simple things like talking to friends, journaling, a piece of paper and a pen or a pencil is not expensive. You don't have to join a fancy class, but you can keep a little journal where you just write for 5 minutes at the end of your day just to get out some stress. Keeping a gratitude journal, things like this that are pretty simple to do. So I call these things, I tell people it's a self-care routine that you need to try to think about and try to implement in your life. And I know the wellness industry is a multi-billion-dollar industry, and talks about all these things that you should be doing, cold plunges and meditation, 3 times a day and things like that. But having a self-care routine that maybe takes about 10 minutes out of your day. So maybe it's a 2-minute, deep breathing in the morning, right when you wake up and before you go to bed, doing some stretching and doing some journaling, a cup of tea, sitting by yourself in quiet for 5 minutes without your phone. There are things that we could do that shouldn't take up an enormous amount of time. It's just getting in the routine of doing something that works for you. And
So,
and
so,
doing it
so,
consistently, and people will start to notice a change in how they feel after some period of time. And then when you stop doing it, of course, you go back to not feeling as good.
Doctor, a couple other things quickly. I was at the gym yesterday, and I look around, and octogenarians and people who are in their 80s and maybe even approaching 90, they're there, and they know something that I guess some of the younger of us don't know. because they're there. And so you don't have to, when you go and work out, you don't have to lift 200 pounds, I guess, and you don't have to run a relay race. You just have to keep active and busy. Is that correct?
Yeah, this is very correct. So, exercise and activity, physical movement, really is the fountain of youth. Physically for us, mentally for us, we know that exercise and being active throughout our lifetime is one of the biggest ways that we can prevent cognitive decline and dementia. We know for sure that there are numerous cardiovascular benefits, there's mental health benefits. We know that falls and fractures are. A large cause of sort of morbidity and mortality for our older people in the United States. And a lot of this happens because people haven't moved for decades of time and they've lost a lot of muscle mass and they have osteoporosis or osteopenia. And when you don't have muscle mass, you're off balance. It's difficult to walk. It's difficult to recover if you take a small misstep or get bumped. And this is why people fall so easily. And then when they fall, they're fracturing bones, which tends to be really the beginning of decline for people, functional decline for people in the later years. So staying active, moving, trying to maintain your muscle mass by doing some strength training. This could be band work. If you like to lift weights, it could be weights. It could be body weight movements like push-ups and squats and things like this. And so focusing on staying active, functional, maintaining functional movements is so important. One thing I always observe with my patients is how do they get up from the chair when I ask them to get on the exam table? And most patients can't get up. My older patients in particular cannot get up without using their arms, their arms to push them off the chair, which means they most likely can't get up from the floor either without using their arms. And we know that that's a poor prognostic indicator because people have poor core muscle strength and poor lower extremity strength. So,
Last thing. I'm
yep,
sorry, last thing.
that's
Heredity. What
yeah.
role does that play?
Our genes probably determine our health outcomes, probably about 20% of what our health outcomes will be. But our lifestyle, the way that we live in our environment, interact with our genes. So there's a whole area of epigenetics. So this is the environmental influence on gene activation. So what we eat, how we move, our mental state turn on and off genes in favorable and unfavorable ways. So we have a lot more power and control over our health than we realize. And yes, family history is important, but if you think about family history, it's not just genetics that family history relates to, because people and families tend to live similar lifestyles and eat similar foods and similar movement and things like that. So you are not destined to have a heart attack and stroke just because your parents did or your grandparents did. Living a healthy lifestyle, getting screened for things like high cholesterol, high blood pressure, diabetes, and being proactive if you start to develop these things to try to reverse them with healthy lifestyle. And if you need medication, taking your medications, of course, meeting with your doctor regularly to talk about your concerns. But I think one thing I love about what I do in prevention is I really try to empower people that you have control over your health and you can restore your health if you already have chronic illness, or you can prevent yourself from developing chronic illness in the future. So,
So I would like to say thank you from the depths of my heart, Dr. Aimee Zullo. She's a non-invasive cardiologist specializing in managing and preventing cardiovascular disease. And you're with Froedtert and the Medical College of Wisconsin Health Network. It's been really informative. I hope that we can do this again.
it's been a pleasure, Earl. Thank you for having me, and I'd love to come back in the future.
We'll certainly make that happen. Thank you very much. Have a great day.
Yes, have a great day.
All right. Bye.
Bye.
All right. That's it.